Not even a trouser is on you.
Following the devastating Ebola pandemic, many frontline workers, such as doctors and nurses, continue to face the risk of contracting the deadly virus. The demise of Dr. Mohamed Ali, a medical intern at Fort Portal Regional Referral Hospital, to the Ebola virus brings the death toll of health workers to 2, an issue of concern to the Uganda Medical Association. While addressing journalists today at Mulago, different health practitioners from the different medical associations paid tribute to their counterpart who died in the line of duty before asking government to give them materials they need to combat the virus.
We've lost 2 so far. Yesterday we lost a KIU SHO. But remember, these SHOs who are deployed in these hospitals, they're not facilitated.
According to the president of the Uganda Medical Association, Dr. Samuel Odongo Oledo, government should equip all the health facilities with personal protective equipment, PPEs, to handle the Ebola outbreak in any part of the country.
All regional referral hospitals should be equipped with enough PPEs at such a time to be able to fight this deadly disease, because we have movements, free movements. So there are great chances that if these cases present themselves in the other regional referral hospitals, we must be well equipped, as is Mubende at such a time.
Dr. Odongo wants the Ministry of Health to conduct trainings for the medical interns at the forefront of the Ebola fight and to adequately compensate them.
The safety and appropriate medical care of medical workers serving in the Ebola treatment units, in the epidemic, and the care of those who have been infected and hospitalized in the different units, including J-Medics.
Dr. Asaf Biamukama, the president of the senior health officers, wants government to also find ways of uplifting the morale of the doctors and the frontline workers.
Of the people, of the doctors especially, and other health workers who have contacted the virus. Because we are seeing our colleagues dying, and if this continues, I think our morale is going to be very low.
Doctors are also demanding for extra trainings to help them acquire knowledge and skills to help deal with the pandemic.
All of us are training to be specialists, but what is the essence of us being trained and the next day we are on the streets? Yet we have pressing issues like COVID and Ebola that are taking a big number of us.
The president of medical interns in Uganda, Musa Lumumba, has also urged government through the Ministry of Health to create an emergency fund for Ebola.
As a country, through Parliament, can we also come up with an emergency Ebola fund to make sure that we have resources to buy these PPEs, but also to facilitate doctors, nurses, and everyone who is involved at the front line?
According to the World Health Organization, health workers combating dangerous diseases and viruses should always have assurance from their governments that they will be compensated for their efforts, hence being allocated a risk allowance. Kevin Kasoma, CTV PM Edition.